Hi, Joe.
All right.
Hi. My name is Melissa. I'm the student nurse practitioner, and I'm going to be doing your head-to-toe examination, okay? Do you have any questions?
No.
All right, perfect. So I'm observing his general state of health. He seems to be in good physical condition, good physical health, no obvious emotional or physical distress. So, and then I'm just going to be observing his skin. I'm noting the skin, the color, the temperature, the turgor, the moisture, looking for any lesions and scars, which I don't see any. Can you spread out your fingers for me? I'm checking for deformities. Cap refills brisk less than 3 seconds. Can you grip my fingers? Grip strength 5 bilaterally. Radial pulse is symmetrical, 2+, good rate, rhythm, and amplitude. Okay. Let me know if there's any pain or tenderness as I palpate. Wrist joints, no warmth, pain, tenderness, or swelling. Any pain or tenderness? No pain or tenderness at the forearm. Inspecting the olecranon processes. Any pain or tenderness? No warmth, pain, tenderness, or swelling. Moving up the arm. No warmth, pain, tenderness, or swelling. And then the glenohumeral joints. Any pain or tenderness there? No warmth, pain, tenderness, or swelling. Can you bend at your elbows? It's good flexion. Can you extend? Can you move your palms to the floor? Good pronation. And palms up, good supination. Arms up laterally over your head. We're checking your shoulder range of motion. Good flexion. Extend all the way back. Good extension. Can you cross your arms at your body? Good adduction. And then can you place your hands over your head just like I'm doing? This is a good external rotation. And then place your arms behind your back. And I'm just going to kind of note the symmetry. Good internal rotation there. So go ahead and place your hands just like that. I'm going to place pressure. And can you pull against me? Bicep strength 5 bilaterally. And then can you push against me? Tricep strength 5 bilaterally. And then can you place your fists together? Just like that. I'm going to apply pressure and don't let me do it. Deltoid strength 5 bilaterally. One thing I forgot to do with your fingers, I just want to assess for clubbing, if you wouldn't mind. I see the window, so no clubbing. Perfect. So now I'm moving on to head and neck, observing hair, even hair distribution, no infestation or rashes. Looking at the eyes, no edema, exophthalmos, or swelling, or lid lag. Looking at the sclera, can you look up, down, left and right? Okay. Sclera, white conjunctiva clear. Do you wear any glasses or contacts?
Glasses, but I don't have them with me.
Okay. All right. So I want to do a couple tests just to test your eyes. So the first test is we're going to be testing cranial nerve 3, 4, and 6. That's ocular, motor, trochlear, and abducens. I want you to look at my finger and just with your eyes, just follow. Just with your gaze. I'm looking for any nystagmus. I am not seeing any. Perfect. Next test I'm going to do is pupillary reaction. This toe, I'm just going to shine a light in your pupils, okay? So if you could just focus on something ahead of you and just focus on that. I'm testing for cranial nerve number 2, the optic, as well as cranial nerve number 3 is ocular motor, okay? Good direct, good consensual, pupillar response, good direct, good consensual pupillar response. Keep your eyes focused, and I'm going to put up a finger and look at my finger, and then look back at the wall, look at my finger, and adjust to accommodation too, so pupils are perla. The next thing we're going to do is the fundoscopic exam, and that is cranial nerve number 2. So keep looking. I'm going to get up close and look at the back of your eye, okay? So I'm coming in, 15-degree angle, same eye, the same eye, checking red reflex, and then making sure that I can see in the back structures of the eye. Perfect. Moving on to the next. 15-degree angle, checking red reflex. Moving in. Looking in the back of the eye. Okay. I was able to visualize the retina. Both eyes, I was able to see the disc, the optic disc, the margins were well defined and were clearly defined. The cup to disc ratio was 1:2, was peach in color, and I was able to visualize the vessels. And there was no AV nicking or hemorrhaging or lesions. Moving on to, are you okay?
Yeah.
Okay. Moving on to cranial nerve number 8, the acoustic. Would you mind just occluding one of your ears? There you go. I'm going to whisper something. I want you to tell me what it is, okay? Seattle. Okay. Other side. Okay, perfect. Cranial nerve number 8 is intact. Next is the exam. I just want to take a look at your ears, okay? The first thing I'm going to do is I'm going to inspect the auricle tragus. Any pain or tenderness? No pain, tenderness there. No discharge. I'm going to just take a quick look. Going up and back. Perfect. Up and back. Oh, nice. Interesting. Oops, excuse me. So I was able to visualize both ear canals, and they were without any drainage, redness, or swelling. And then I was also able to visualize both tympanic membranes. They were pearly gray in color. There was no bulging. And I was able to visualize both cones of lights and the bony landmarks as well. So moving on to the nose. Are you able to smell coffee brewing in the morning, or able to smell the food that you're cooking?
Yeah.
Okay, then that is cranial nerve number 1. The olfactory is intact. I'm gonna take a quick look at your nose. Would you mind just tilting your head up? And then I'm just gonna visualize. Perfect. All right. So here I was able to visualize the septum on both sides. They were, the nasal septum was midline. I was also able to visualize the inferior and middle turbinates. They were pink and moist. There were no polyps, and your mucosa in your nose looked pink and moist as well. And there was no extra discharge. So moving on to your mouth. Are you having any issues tasting your food?
Nope.
Okay, so that is cranial nerve number 7, the facial, and cranial nerve number 9, the glossopharyngeal. I'm gonna get my glove. And would you mind opening your mouth? Okay, perfect. And then I am just gonna, can you open one more time? Lift your tongue up to your roof, your mouth. Perfect, and then I'm just gonna palpate the tissues, as well as your tongue, and then move your tongue up against your roof of your mouth. Perfect. So, I was able to visualize that your buccal mucosa was pink and moist. There's no lesions, no nodules. There's no leukoplakia. You have good dentition. You didn't have any obvious caries. Your tongue was midline, and that was glossal. That was hypoglossal cranial nerve number 12. Would you mind opening your mouth one more time and just sticking out your tongue and saying ah? Okay. So cranial nerve number 10 is intact. That's your vagus, where I saw your uvula is midline, and it rises symmetrically, as well as your soft palate. Okay. So moving on to cranial nerve number 5, the trigeminal. Can you clench your teeth? I'm just going to palpate the strength and tone of your masseter and your temporal muscles. So good strength and tone. Open up and close, and then wiggle your jaw around. Okay, perfect. No crepitus noted. Cranial nerve number 5 is intact. Cranial nerve number 7. Can you smile for me? Frown. Puff out your cheeks. Wrinkle your forehead. And then keep your eyes shut. There you go. I'm going to touch your eyelids. Don't let me. Open up your eyes. So cranial nerve number 7 is intact. And then cranial nerve number 11, spinal accessory. I'm going to place my hands on your shoulders. Will you shrug against my resistance? Thank you. And then would you mind pushing against my hand? I'm pushing against my hand. Okay, so spinal accessory was intact. Moving down to your neck. We're going to do some range of motion. Can you touch your chin to your chest? That's good flexion. And then extend your neck where you look up to the ceiling. Can you look to your right? Look to your left. Let me know if there's any issues with your range of motion, or if you're feeling like there's anything, any reduced range of motion, okay? And then can you touch your ear to your shoulder? And then touch your other ear to your shoulder. Good. I'm going to have you take a sip of your water while I observe the way that you swallow, if you wouldn't mind. Just hold on to that. Do it one more time. Okay. Trachea is midline. And then I'm actually going to have you hold on to that because I'm going to assess you from behind too. So I'm assessed for your thyroid. There's no visible goiter. Take a sip of water. Okay, take one more. Going for the lateral lobes of the thyroid, and thyroid is not enlarged. Okay, perfect. Thank you so much. So now we're moving on to your thorax. So I'm able to visualize that your AP dimension is less than your lateral dimension. And then toe, would you mind taking a deep breath? Okay, and then do you want to lift up your shirt? Thank you. I'm assessing T10 here. Would you mind taking a deep breath? All right, good symmetrical chest expansion. Now I'm going to palpate your posterior spine. Let me know if there's any pain or tenderness, and I'm actually just assessing for any step-offs, which I don't feel. And then I'm going to palpate your paravertebral muscles. I'm looking for any spasms. Is there any pain or tenderness there? Any pain or tenderness? No? Okay. Now we're going to auscultate your lungs. With using the diaphragm, when I place my stethoscope on your back, can you please take a deep breath in and out from your mouth? Okay, now I'm going to assess your right lobe here. One more time. And one more. Okay, bronchovesicular sounds, no wheezes, crackles, or rails. Moving to the front. Same thing, just with on your chest, okay? When you feel my stethoscope, take a deep breath in and out of your mouth. Bronchovesicular sounds, no wheezes, crackles, or rails. Now I'm just going to listen to your heart, okay? There's 1, 2. Second intercostal space, right sternal border is the aortic valve. Second intercostal space, left sternal border is pulmonic valve. Walking down the left sternal border is the tricuspid. And I'm hearing normal S1, S2. And then the mitral valve, fifth intercostal space, about mid-clavicular line, S1, S2. Okay. Now, if you wouldn't mind, I'm just going to palpate your central axillary nodes. This may be just a little bit uncomfortable, okay? Just get under there. Okay. No lymph nodes palpable. No lymph nodes palpable. You all right?
Yeah.
Okay. Next, what I'm going to do is I'm going to palpate your other lymph nodes that I forgot to do earlier. So I'm going to do your preauricular. post-auricular, superficial cervical, deep cervical chain, posterior cervical chain, tonsillar, submandibular, submental. Not sure if I did the occipital, I'll do it again. And then the supraclavicular, infraclavicular. No nodules or no lymph nodes. Next is the breast exam. So if you wouldn't mind putting your hands on your hips and just pressing into your hips. No lesions, scars, no changes in skin contour, no deformities, no mass or gross asymmetry, and no dimpling or retractions. Can you put your hands up above your head? Same thing, I didn't see any changes in skin color or contour or no retractions or dimpling. And if you wouldn't mind, we're gonna do a breast exam if you wouldn't mind laying down. Oops. Is that
Pillow.
okay? Want your pillow? Okay. All right, put your hand over your head, starting at the mid-axillary line at the tail of Spence. I'm using 3 points of pressure, moving throughout the breast, noting any masses or pain and tenderness in the patient, making sure that I cover all the breast tissue, all the way to the sternum. 3 points of pressure, I'm not sure if I said that. Okay, other side. Nope, we'll just go like this. And I'll put this from you. There you go. Starting with the mid-axillary. Using the pads of my fingers, making sure that I cover all the breast tissue, and then also making sure that I go over the nipple looking for any discharge, which there doesn't seem to be any. Okay, next is auscultating the carotid arteries. 2+, good rate, rhythm, and amplitude. 2+, good rate, rhythm, and amplitude. And then do you want to put your arm down? I'm going to place this just to be a little more comfortable. There you go. Listen with the bell on my scope for bruise. No bruise. Listening for murmurs. Starting again, second intercostal space. Right sternal border, aortic valve with the bell. Moving over directly across to the pulmonic, tricuspid. And then the mitral. No murmurs. Precordium without any deformities or impulses. And then locating the apex. PMI. PMI is not displaced or enlarged. It's a fifth intercostal space mid-clavicular line. Now moving on to the abdomen, inspecting no scars, lesions, any deformities. Color is even. Listening with the bell at the abdominal arteries. With the bell, aorta. Renal arteries. Iliac arteries, no bruise. Switching to the diaphragm for bowel tones. Bowel tones normal, active, and gurgling. And the percuss. maybe a little bit of dullness in the lower left quadrant. Would you mind bending your legs for me? Can you bend your legs? Just like that. Okay. Now we're gonna do some little light palpation. Maybe a centimeter, just a centimeter deep in all 9 quadrants. I'm looking and assessing for any pain or tenderness, rigidity, or guarding from the patient. And then let me know also if this is uncomfortable for you. Moving on to deep palpation in all 9 quadrants. I'm noting any masses. And also wanted to point out that when I was percussing, I didn't hear any fluid, air, or masses. Everything was tympanic except for maybe a little bit in the left lower quadrant, maybe a little dullness. So now I'm going to palpate your liver. Go ahead and take a deep breath and blow out. Trying to assess for the edge one more time. Liver not palpable. Going down to the spleen. Take a deep breath. One more time. Spleen also not palpable. All right, you can straighten out your legs. Move into the femoral arteries. 2+, good rate, rhythm, and amplitude. Feeling for any inguinal nodes, and I don't feel any inguinal nodes. I'm gonna palpate your legs, so for your hips, any warmth, any tenderness or pain? No warmth, pain, or tenderness. I'm also observing his skin color, the hair distribution, as well as looking for any scars or lesions in his legs, and also assessing for differences in alignment or muscle mass symmetry as well. Moving on to the quads, any pain or tenderness. Moving on to the patella, making sure that I assess the joint lines. Pain, no warmth, pain, or tenderness in either of those. Okay, moving down to the shins, and then the gastrocnemius. No pain or tenderness. Okay. On the ankles, and also the feet. And assess the dorsalis pedis. Say 2+, good rate, rhythm, amplitude, symmetrical. All right, we're gonna do some range of motion. And we're gonna flex. Is this all right? Noting any crepitus or any of him being uncomfortable with any of this. And extension, and then we're gonna abduct. We're gonna adduct. I'm gonna internally rotate. Okay, and then externally rotate. Perfect. Same thing on the other side. I'm gonna flex, extend, abduct, adduct, internally rotate, and then externally rotate. And then I'm going to ask for you to do some active range of motion. Can you point your toes to the floor? Good plantar flexion. And then point your toes up to the ceiling. Good dorsiflexion. And then can you touch the bottoms of your feet together? That's good inversion. And then the tops of your feet together. Can you manage to do that? Good eversion. It's a little bit, okay. A little tight. Okay, we'll have you sit up. Okay. Doing a little coordination. If you could just, we're gonna slap your thighs with the palm and then slap your thighs with the backs of the hand. And then can you do that as fast as you can? Okay. Good coordination and fine motor skills. Now we're gonna check deep tendon reflexes. So just relax your arm. I would say 2+. 1+, triceps. Say 1+ there. Relax your arm. 2+ there. Brachioradialis. Ooh, good. 2+ there. 2+. Patellar. Ooh, 2 plus. 2 plus. Your Achilles. 1 plus there. All right, 2 plus there. Okay. Now if you wouldn't mind standing up and then facing the windows. I am noting the curvature of his spine. I'm noting that his cervical and lumbar are concave and the thoracic is convex. There's no kyphosis or lordosis. Can you bend at the hips and touch your toes? This is checking for spinal range of motion flexion, and I don't see any lateral curvature of the spine, so no scoliosis. Can you stand up? And then I'm gonna be right behind you if you could bend backwards. Okay, good extension. Can you turn just with your shoulders facing to the right? Good rotation to the left. Okay. And then can you bend just at the hips to your right side? Perfect. And to your left. Any pain or tenderness with any of that?
No.
Okay. The next thing is standing on one leg. Can you stand on one leg? And I'm noting that his hips are even in height. And can you bend at the knee? He has good balance. Okay, other side. And then bend. Good balance, and your hips remain even in height. And then I also want to mention that when he's standing, I'm looking at his spine. I see that his shoulders and hips are even in height as well. I'm not sure if I said that before. Next is walking. Can I observe you just walking forward to the next bed? No widely displaced feet. And then when you come back on your heels, no shuffling. Good coordination with his hands and his legs and on your toes. And then tandem walking, where you are putting one feet. Yeah, exactly. And good coordination, no widely displaced feet, no leg lag or foot flop or any of that. Okay. Perfect. Now the GU exam. So I would have the patients stand up in front of me. Can I just talk about this? He would be standing and I would be sitting. I would don my gloves, and we'd start with inspecting the external genitalia. So I'm looking at the hair distribution, noting any rashes or infestation, noting any obvious signs of any warts or lesions on the outside. We'll start by palpating the shaft of the penis, noting any nodularity or any pain or tenderness in that. I move to the shaft and palpate the shaft, noting any nodules, pain or tenderness with that. If he's uncircumcised, I'd have him retract his foreskin, and so I could observe the glands. And then moving on to the urethral meatus, looking for any extra discharge, noting that. Moving on to each testy, I would palpate one testy at a time, and I'm noting for any nodularity, pain, warmth, tenderness, or swelling. Locating the epididymis, following that to the spermatic cord, along to the front and to the inguinal, external inguinal ring, where I would push my finger through and check for hernia, have the patient turn and cough. And then I move on to the other testy, and I palpate the testy as well, looking for any nodularity, pain, tenderness, or swelling. Follow the epididymis to the spermatic cord and into the other external inguinal ring, push through and have the patient turn and cough, looking for any hernias. After that, I would have the patient tell him I was going to do a prostate exam. He is free to stand up and face the table and sort of bend over, or he can lay on his side. However he's going to do it, I'd have some lubricant and gloves, and I'd take off my gloves I had. I'd probably hand hygiene, put on another pair of gloves, lubricate my finger, and tell him that I was going to insert my finger in his rectum, ask him to bear down, gently insert my finger into his rectum, feel for the prostate, locate the medium sulcus and the lateral lobes of the prostate, noting that it should only protrude into the rectum about a centimeter. It should not be tender. And feeling around the walls of the rectum for any nodularity, pain, or tenderness as well. With that, I can take out my finger. If there's any stool, I can send that to a lab for occult blood and give tissues to the patient to wipe up, take off my gloves, go wash my hands. For GU exam, the woman would be lying in the lithotomy position. I'd be sitting in front of the exam table. I'd have her legs draped with a little depression at her knee so I could talk to her and she could see my face. I would tell her that first I'm just looking at her external genitalia. I'm observing the labia majora, the perineum, and the rectum, looking for any lesions or any warts, looking for any obvious swelling, and noting the hair distribution and noting any rashes or infestations. Then, with her permission, I would open up the labia majora to look at the labia minora, the clitoris, the urethra, as well as introitus, looking for any discharge, redness, swelling, any warts or lesions. At this time too, I'd have a speculum in warm water too, ready for me. So I'd tell her that we're going to proceed with the pelvic exam. I would have my speculum already in warm water. I'd take it out of warm water and place my fingers at her introitus with downward pressure. I'd insert the speculum at a 45-degree angle and rotate it around, open the clamp, get the cervix and the os in view. Once it's in view, I could lock it. I could observe the cervix and the os for any bleeding or any discharge or any warts or lesions. Inspect the vaginal walls as well, looking for any lesions, any warts or any drainage or any redness. Unclamp the speculum, pull it off the cervix with it open, making sure that I clear the cervix, and then I can gently close and pull out the speculum from the vagina. Make sure that I change my gloves and get some lubricant, and we proceed with a bimanual exam. And I would lubricate 2 fingers, insert into the vagina, noting any nodularity or any pain or tenderness as I palpate around the vaginal walls. Locate the cervix, wiggle the cervix around for cervical motion tenderness, and assessing that in my patient's face or asking her if she has any pain or tenderness with that. Then I go and palpate the uterus, where I lift my fingers up and I do a sweeping motion over the suprapubic area, trying to locate the uterus in between my hands, noting the size and the shape, as well as the nexa, her right ovary, palpating that in between my fingers, and then moving to her left ovary and palpating the left ovary in between my fingers, noting the size and the shape of the ovaries and the uterus, and noting any pain or tenderness with that. I think that's it.
Okay, so you have 7.5 minutes left. You can end now, or you can just think through the exam.
I will think through the exam.
Okay.
Just figure out. Okay. I'd ask you guys for hints, but I know that's not allowed. It's all right. Now I'm starting to second guess if I did any of this stuff. do I just chime in if I think I've said something? Like, how do you?
I mean, if you, if you feel like you want to add anything, you can just say it.
When I was inspecting the abdomen with tangential lighting, I'm noting any venous formations, look at the color of the contour, any obvious deformities, any obvious masses. And then I listen to the aortic, abdominal, 8 arteries, no bruits. Listen to the sounds, percussion. I'd like to add that when I percuss the abdomen in 9 places, I'm looking for any fluid air or masses. Everything was tympanic, except for maybe a little dullness in the left lower quadrant, but I think I mentioned that. Okay, I'm just done. I'm done.
All right. Good
Sorry.
job.
Sorry, guys. Maybe you guys could try it.
That was actually a perfect exam. After I said we've never had one. Oh, yeah, go ahead.